Hello, this is Dr. A with your Intro to U.S. Healthcare lesson. We are on Chapter 8, looking at careers in the health industry, and we're using the 5th edition of the Basics of the U.S. Healthcare System. All right, because of the aging of our population, the Bureau of Labor Statistics indicates that the health industry will generate nearly 2.5 million new jobs by 2026, which is just right down the road. When one thinks of healthcare providers, one automatically thinks of physicians and nurses. But there are so many other jobs that you can do. And we have allied health professionals who represent nearly 60% of the healthcare workforce. So that's more than half, right? More than half of the healthcare workforce aren't doctors or nurses. And they provide a range of essential healthcare services that usually complement the services provided by physicians and nurses. There are often like support services and things that the physicians and nurses do not have time or the expertise to do. So we're going to look at all of these health careers. In most states, only physicians, dentists, and a few other practitioners may serve patients directly without the authorization of another licensed independent health professional. So those categories that can directly serve are chiropractic care, optometry, psychotherapy, and podiatry. That's on top of physicians and dentists. Some states will also authorize midwifery as a physical, as well as physical therapy as a automatically serving directly the patient without independent supervision. And it's, some people say midwifery, so it's probably the better way to say it. There also continues to be a shortage of nurses nationwide, and also a shortage of many of the allied health professionals, and there's a shortage of physicians. So this is a job market that's really good to get in. It is projected that nursing shortages will continue to lag behind nursing staffing needs, and this is particularly true because of the pandemic. So the pandemic did cause some burnout on a lot of the nurses that were currently working, and some left the profession because of it. So this chapter will provide a description of the different types of healthcare professionals and their role in providing care in the healthcare system. So we're going to start at the top with the physicians, and we're going to talk about physician education. So there are two routes you can go to you have the MD, Doctor of Medicine route, and the DO, Doctor of Osteopathic Medicine. Now, it's also important to know that what Europe considers DO is completely different than what we do in the U.S. So their education is very similar, but there are some key differences. So MDs are trained to use an allopathic approach, which means they actively intervene in attacking and eradicating disease, and they focus their efforts on the disease. So the MDs tend to be trained in the traditional model of testing, diagnosis, and then the fixes, either a surgery, a medication, or maybe a therapy of some sort. And they can also pretty easily specialize. And so if you have a problem with your gut, you go see a gastroenterologist. If you have a problem with your skin, they might send you to a dermatologist. And so there's a lot of subspecialties there. Now, DOs tend to stress preventive treatments, and they use a more holistic approach to treating a patient, which means they do not focus only on the disease, but they focus on the entire person. So a DO might recognize that a skin problem could be caused by gut problems because they look at all of these systems as being interconnected. It's just a different approach. They both can work as general practitioners. MDs, again, tend to specialize more, but even DOs can go into some of the specialties. They tend to be trained more to be general practitioners, though. So in 2021, there were 727,000 physicians, with growth expected to be 3%, which is a little slower than average. So maybe we're catching up with our, but again, maybe not, because there's still is projected to be a physician shortage between 40,000 and 100,000 physicians by 2030. And so these figures have also been exacerbated by the pandemic. Some people may have not chosen to go into healthcare because of the pandemic. Some people may have left healthcare because of the pandemic. Some people may have died during the pandemic, right? And so the pandemic has definitely caused some problems for healthcare. The wages for physicians and surgeons are among the highest of all occupations. The differences in salaries are a reason for shortages of generalists, so your primary care physicians, which then results in what we call specialty maldistribution, meaning doctors want to go into all the specialties, and you have all of these specialists, but not enough general physicians, generalists, family practitioners, etc. And this is because specialties pay more. And also there are less specialists in rural areas. They tend to be in urban areas. And so if you're in a rural area, you usually have to go to the larger city to be able to visit specialists. So just as a kind of fun thing to look at, here are some of the salaries and for 21-22 and 2020-2021. So it's, their salaries have been growing over here with the inflation, but the top paid is the orthopedic surgeon, $565,000 a year. That's a lot of money. But if you look, even nurse practitioners make really good money, and your family medicine physician makes $250,000. That is still great salary to make. Obviously, there's ways to make more, but if you look at a lot of these top ones, they are all specialties here. So that's just kind of highlights the problem. There is another underlying issue here, is that this type of salary, although I think doctors should be really well paid, is part of why healthcare costs a lot in the U.S. It's not the only reason, but it is part of the problem. So generalists are usually called primary care physicians. Family care practitioners are also called generalists, and you can call them family doctors, as are general internal medicine physicians and general pediatricians. So these are all PCPs, primary care physicians. They can also be called all of these other things. Their focus is preventive services, such as immunization and your wellness exams. And usually if you have a problem, something you're concerned about, it is always a good idea to go see your PCP first, primary care physician. And then if the problem is severe enough where there is a need to go see a specialist, then your primary care physician can make that recommendation, and it will prevent you from wasting your money making appointments with specialists whenever they're not needed. So this is what we call gatekeeping. And so primary care physicians are gatekeepers for patients. So they coordinate the patient care if the patient needs to see a specialist. Now, there's a lot of insurance companies that will allow a person, that one of their beneficiaries, to just go see a specialist. And by all means, you can do that, but specialists are always more expensive to go see, and why go see a specialist if your primary care physician can take care of the problem? So specialists are required to be certified in the area of specialization, and they also require additional years of training, meaning their residency is usually longer after they have finished med school, and then they also need to take a board certifying or credentialing examination for that specialty. The most common specialties are dermatology, cardiology, pediatrics, pathology, psychiatry, obstetrics, anesthesiology, specialized internal medicine, gynecology, ophthalmology, radiology, and surgery. Next, let's talk about hospitalists. We've mentioned this in previous lessons, but a hospitalist is a physician who provides care to hospitalized patients. The goal here is for the hospitalist to replace the patient's primary care physician while the patient is hospitalized. And a hospitalist's job is to monitor the patient from admission to discharge. And they usually do not have a professional relationship with the patient before the hospital admission and after the discharge. And often, even if the patient is there for an extended amount of time, they may see different hospitalists as they rotate on and off duty while they're at the hospital. So this is a new type of physician. It evolved in the 1990s. It is usually a general practitioner and is becoming more popular. Because a hospitalist spends so much time in a hospital setting, they can provide care that is more efficient. And so you have to think about what this replaced. So what it replaces is, before hospitalists existed or this career was made possible, your primary care physicians had to make rounds at the hospitals to see their patients on top of having to go to their clinic. And maybe they were not all as proficient as how the hospital operated, things available, the protocols, etc. Hospitalists know what to do, how to do it, and they are efficient. And plus that then frees up the primary care physicians to be in their clinic and seeing patients there. So from a hospital's viewpoint, the focus is, of course, on maximization of profit. So what you have to know is that oftentimes hospitals now are paid a certain amount of money per diagnosis, and they must manage that patient within that amount of money they receive. And if it costs them more money to care for that patient, then oftentimes it's money that they'll lose. And so having efficient care is really good. So let's say if they had $5,000 to take care of a patient for a certain amount of time for a certain diagnosis, and they were able to do it for $4,000, they get to keep the extra $1,000, and that's where the profit is. And that can, be put back into the hospital. And so ideally, that means a shorter length of stay for the patient, decreased complication, and increased patient satisfaction. And they have found that hospitalists can provide all of these things. So in 2022, there are 50,000 practicing hospitalists in the U.S., and their 2021 salary was $290,000. So a good salary. So let's look at non-physician practitioners. So these include non-physician clinicians and mid-level practitioners. They are essentially physician extenders because they are often used as a substitute for physicians, especially in rural and underserved areas. They are not involved in the absolute total care of a patient, so they usually just collaborate closely with physicians. Although nowadays you can have a non-physician practitioner, like a nurse practitioner or a PA, as a primary care provider. So my husband's primary care provider is a friend of ours that is a nurse practitioner. And if she has issues or problems or questions, she can consult with some of the other MDs that are in the clinic. So the categories of non-physician practitioners include physician assistants, nurse practitioners, and certified nurse midwives. So these non-physician practitioners play an important role in areas that are underserved by physicians. So those are rural areas, underserved urban areas, community health centers, in a managed care environment, so they can plug in a lot of the gaps. And they are used with repetitive technical tasks such as screening patients for disease, but taking care of non-life-threatening cases in the emergency departments, urgent cares, clinics, practices. They can perform physicals, drug testing, and other routine activities. Their salaries are nearly 50% less than physician salaries, so therefore they're a cost-effective caregiver. And we're seeing more and more of our clinics now have a blend of MDs, DOs, nurse practitioners, PAs, and making it all work to run the clinics in efficient, cost-effective way, in an efficient way. So your physician assistants, the PAs, are a category of non-physician practitioners that provide a range of diagnostic and therapeutic services to patients. They can take medical histories, conduct patient examinations, analyze tests, make diagnoses, and perform basic medical procedures. They are able to prescribe medicines in all but 3 states, and they must be associated and supervised by a physician, but the supervision does not need to be direct. So, for example, my husband has a cardiologist. He saw the cardiologist on his initial visit. He's going for a follow-up. He's going to see the PA for his follow-up. And so, again, it's a routine checkup, follow-up on the medication. If the PA has any questions, she'll be able to talk with the cardiologist. And it's a way, again, to administer care in a more efficient and cost-effective way. So in many areas where there's a shortage of physicians, the physician assistants act as primary care providers. They collaborate with physicians by telephone and on-site visits. The book says there are 200 accredited 2-year PA school, but I've looked it up and it's up to 300 now. So it's a growing profession. Employment growth is expected to be 30% growth by 2030. And the 2021 median annual salary is $121,530. Other healthcare professionals, so let's dive into some of these other high-level practitioners. So we have our dentist, right? They prevent, diagnose, and treat teeth, gum, and mouth disease. They are required to complete 4 years of dental school from an accredited dental school once they have first completed a bachelor's degree. And the bachelor's degree is usually in one of the sciences. Biology is quite common, chemistry, something like that. They are awarded a Doctor of Dental Surgery, a DDS, or a Doctor of Dental Medicine, DDM. In 2022, there were nearly 139,000 dentists in the United States. More than 90% of those are in private practice and are primarily general practitioners. Your average annual income for a dentist is $163,000. So while we're talking about the dentist, we're going to talk about the dental hygienist also. So these are not a higher level practitioner, but they are very important to your dental offices. So your dental hygienists clean teeth, they examine patients for oral diseases, and they provide other preventative dental care to educate patients on ways to improve and maintain oral health. Dental hygienists typically need an associate's degree in dental hygiene. They must pass a national licensing exam and state licensing exams. And this occupation is also expected to grow by 20% by 2026. And in 2021, the average median salary for dental hygienists is $77,000. Now, also, we have dental assistants. So they collaborate with dentists with the preparation and treatment of patients. There is no licensing required. They could pursue an X-ray certification. They perform a lot of administrative and record-keeping duties. The 2021 median pay was $38,660. So again, that's a low-level pay. You can put dental assistants on the level of like nurses' aides and things. So they're kind of a very entry-level type of profession. There's a projected 11% growth by 2030. Pharmacists are responsible for dispensing medication that has been prescribed by physicians. They advise patients and healthcare providers on side effects of medications. The Doctor of Pharmacy programs require applicants to have taken a lot of post-secondary, meaning university level, so undergrad courses such as chemistry, biology, anatomy. Applicants need at least 2 to 3 years of undergraduate study before they apply. And for some programs, they want the applicants to have a bachelor's degree, which often might be in, again, biology, zoology, or chemistry or something like that. Chemistry is actually really good undergrad for pharmacy. Approximately 25% of pharmacists will work in hospitals. The other 75%, I'm sure, as you guessed, are in retail. And 2021 median annual salary is $128,570. Chiropractors, they take a holistic approach to treating their patients, which means they focus on the entire body with an emphasis on the spine. In 2021, there were 53,000 chiropractors. It requires a Doctor of Chiropractic degree and a state license. So also you usually do an undergrad in biology or something like that, and then you go and apply for chiropractic school. The 2020 median salary for a chiropractor is $75,000. Optometrists, also known as doctors of optometry, are the main providers of vision care. They examine people's eyes to diagnose vision problems. They may prescribe eyeglasses or contact lenses. They require a Doctor of Optometry degree to do this, and they also must pass a national exam and a national, regional, or state clinical exam, depending on the state. So the 2021 median annual salary for optometrists is $124,300. So, and their undergrad is usually typically in one of the sciences, again, like biology, etc. All right, psychologists study the human mind and human behavior. Some work independently, doing research or working only with patients, while others work as part of a healthcare team, collaborating with physicians, social workers, and others. Psychologists can complete a PhD in psychology or a Doctor of Psychology degree, and the median salary is $81,000. And I believe this is the last one, podiatrists. They provide medical and surgical care for people suffering from foot, ankle, and lower leg problems. Podiatrists must have a Doctor of Podiatric Medicine degree, a DPM, which is a 4-year degree after earning a bachelor's degree. Again, typically do kind of a biology type degree. They require a license to practice and pass a national board exam. In 2021, there were more than 11,000 podiatrists nationwide, and their median annual salary was $145,800. Okay, so that wraps this part up. We're going to see you in the next section. We're going to talk about nurses.